Something that can be very unpleasant related to male health is penile odor, bad smell. But do you know what the causes are, how we can prevent them, or treat them? Follow along with me in this video until the end and stay informed. What are the simple measures you can adopt in your daily life to avoid this unpleasant condition? For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health. And now let's move on to the video. The bad smell in the genital area is a condition that can greatly affect the quality of life, both for men and their partners. It's important to emphasize that the pelvic region, the male genital area, is prone to the overgrowth of bacteria and fungi. This is because it's a warm, humid, and highly vascularized area that remains enclosed for most of the day. These conditions of bad odor may or may not be associated with diseases or simply the overgrowth of fungi or bacteria already present on the man's mucosa and skin. I will now identify the 5 main causes that can lead to this unpleasant condition. The first one is the accumulation of smegma, the secretion produced by the sebaceous glands in the penile region. Some men may have an accumulation of smegma, which is this secretion between the glands and the foreskin, especially caused by excess skin or cases of phimosis, that true phimosis when the man cannot expose and clean his glands properly. This smegma can serve as a substrate for the proliferation of fungi and bacteria, which already colonized the region itself. This can bring a very unpleasant odor associated with the area. Other situations associated with the accumulation of smegma, besides phimosis, are those patients, for example, institutionalized or bedridden individuals who use geriatric diapers. These patients and their caregivers need to pay special attention to local hygiene to prevent the accumulation of this type of substance. The second cause is balanoposthitis, which refers to inflammation associated with the glands and foreskin, the skin covering the glands, especially when it is in excess. These inflammations are often caused by fungi, mainly in poorly controlled diabetic patients, but also in patients without comorbidities. Other situations that can lead to local inflammation include the use of irritating products such as lotions, ointments, or even lubricants, which can cause inflammation. This inflammation can promote the proliferation of germs and the accumulation of secretions, also leading to local odor. The third scenario involves sexually transmitted diseases, STDs, the most common being urethritis, causing urethral discharge, caused by bacteria such as gonococcus, which causes gonorrhea, and chlamydia. There are also STDs that cause local ulcers, such as syphilis and herpes. These ulcers can become secondarily infected and may be covered in pus, resulting in a serious local odor as well as painful symptoms. Treatment invariably involves the use of antibiotics or antivirals tailored to the diagnosis of the infection. The fourth cause is rarer urethritis, for example, those caused by Escherichia coli, which may be related to the habit of anal intercourse. Escherichia coli is a bacterium that inhabits the gastrointestinal tract, but under adverse conditions, it can cause inflammation in the urethra. Other rarer bacteria, such as mycoplasma and ureaplasma, can also cause symptoms of odor and urethral pain associated with discomfort and foul odor in the region. Treatment is based on diagnosis and antibiotic therapy targeted at the infection. And as the fifth cause, though not the least important, are penile cancers, penile lesions that may hide malignant growths and may also have secondary skin infections. Any personal alteration, any nodule, sore on the glands, or on the body of the penis near the foreskin needs to be suspected for penile cancer, especially when associated with local odor. Because these lesions can indeed be infected by fungi and bacteria, they need to serve as an alarm signal for men's health. But what are actually the 5 precautions that we need to take to prevent and treat these conditions that can lead to genital odor? The first thing, folks, is proper hygiene of the area. It's very important for men to wash with soap and water, dry thoroughly, and avoid moisture in the region. When not associated with severe inflammation, the soap used can be the everyday bathroom soap. However, when this area is sensitive or inflamed, it's suggested to use pH-neutral or glycerin-based soaps. Avoid direct contact of the soap with the irritated area and use more of the foam for local hygiene. Rinse and keep the area always clean and dry. Second tip, regarding the frequency of hygiene, this is also a very common question for some men. How many times should one clean per day? Folks, this varies greatly from patient to patient depending on their needs. Patients who experience more odor in this region, not associated with diseases or pathological conditions, need to clean more often, about 3 to 4 times a day. On the other hand, patients who do not experience this type of discomfort can clean once or twice a day appropriately. Third tip, washing the penis after urinating. It's also important that whenever the patient urinates, they remove any residue or trace of urine, which can be a substrate for the proliferation of local germs. Fourth prevention method is postectomy surgery, circumcision. In this surgery, excess skin is removed, and often the constricting ring, the one that tightens the region and prevents proper hygiene, is also removed. It's a commonly performed surgery, a very simple one, but it can greatly improve a man's quality of life, avoiding odors in the area, and especially some STDs, as well as more serious conditions, such as penile cancer. Additionally, diagnosis and treatment of genital infections such as urethritis or STDs, whether common or rare, invariably involve the use of antibiotics, antivirals, or topical medications such as ointments. The fifth tip is the treatment of chronic lesions, those open wounds that can be exposed on both the glands and the foreskin, and the identification primarily of malignant diseases associated with these ulcers. It's not common for men to have chronic wounds in their genital area. This should indeed be a warning sign. These wounds need to be biopsied and treated, either by excision, removal of the same, or even with partial or total penial amputation. And now a bonus, as a more important piece of information. I believe the most valuable tip in the video is for those patients who have this condition not associated with any disease and have ruled out any other forms of pathology, yet still experience local odor and are bothered by the amount of hygiene required per day. It's to undergo postectomy surgery, circumcision, so that your glands will be 100% exposed, preventing the foreskin, the excess skin, from covering the penis. This is the primary way to maintain hygiene and prevent local odor. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.